Turkey stuffing. Okay, so I'm knocking on the door, washing my hands, providing privacy. Hi, my name's Lily. I'll be your nurse today. Can I get your first, last name, and date of birth?
Mary Salazar, 9/11/62.
Okay, perfect. And do you have any allergies we should know about?
No,
All right, great. So can you tell me why you're here today?
just a checkup.
And do you know who the president is?
Trump
Can you tell me where you are?
Baptist Hospital.
Okay, perfect. So patient is alert and oriented times 4, is able to articulate. There's no slurred speech. She's not hard of hearing. Do you have any vision issues?
No,
Okay, she seems to be calm and collected at the moment and has good personal hygiene. And on a scale of 0 to 10, 0 being no pain at all, 10 being the worst you've ever felt, how would you describe your pain right now?
0.
Okay, perfect. So I'm gonna go ahead and start by inspecting your head. I'm just looking for bumps, hair distribution, any infestations. I'm gonna go ahead and inspect your ears now. Of course, I don't have my thing. For drainage, placement, and tenderness. And check your face now for facial symmetry, so go ahead and smile for me. Okay, there's no facial droopage, patient's not pale, flush, or jaundice. I'm gonna check your eyes now for redness, discharge, and sclera. Do you have any contacts or glasses?
no,
Okay, go ahead and follow the light with your eyes only. Okay, follow the tip of the pen with your eyes. Okay, pupils are equal, round, and reactive to light and accommodation. I'm gonna go ahead and inspect your nose now for overall condition, drainage. And go ahead and check for patency. Breathe for me. Okay, I'm gonna inspect your mouth and gums for moisture. Open up. Any cracked lips, bleeding gums, no swollen tongue. Move your tongue from left to right for me. Go ahead and swallow. Okay, there's no foul breath odor. Do you wear any dentures?
no,
Okay, perfect. And I'm gonna go ahead and inspect your neck now, just checking for swollen lymph nodes. Your submental, submandibular, and preauricle. Sit up a little for me. Go ahead and swallow. Okay, there's no goiter present. Trachea is midnight. When I palpate the neck and the head, there's no obvious abnormalities. Can you tell me if you feel this? All right, and you have no difficulty with your ability to smell, sight, or hearing. Okay, I'm gonna inspect your skin now. Just looking for any breakdown of the skin, any bruising or scarring. Everything looks good. And I'm just gonna assess the skin for your temperature. Everything looks good, skin's warm to touch. I'm just palpating now for skin trigger. Okay, great. I'm gonna inspect your upper extremities now, just checking for range of motion and symmetry in performing ADLs. So go ahead and go like this for me. Okay, raise your shoulders up and down. And go ahead and I'm just gonna check for any stiffness or swollen joints. Okay, I'm just gonna palpate now for your radial pulses, your ulnar, and your brachial. Go ahead and squeeze my fingers. Okay, nails look good, there's no clubbing noted. Cap refill is normal, less than 2. There's no IV in sight. I'm gonna go ahead and inspect your chest now. So I'm just looking for symmetry, any bruising or any scarring from any past surgeries. Everything looks good. Go ahead and breathe in and out for me. Okay, there's no use of any accessory muscles. I'm gonna go ahead and now and palpate for any tenderness in the chest. Okay, I'm gonna go ahead and give a listen now to your heart. Okay, just gonna listen to your aortic, your pulmonic, your Erb's point, tricuspid, and your apical. I'm gonna go ahead and give a listen to your lungs now, so deep breath in and out. Okay, do you smoke or use any tobacco products?
no,
And do you have any respiratory conditions, or do you use oxygen at home?
no.
Okay, so go ahead and sit up a little. I'm gonna listen to your back now. First, I'm just gonna inspect your spine. Everything seems to be aligned. Just checking for skin breakdown, any scarring, bruising. So skin breakdown of the coccyx. I'm gonna go ahead and palpate now. For any tenderness, the coastal vertebral. Do you have any pain when I do this?
No.
I'm gonna go ahead and listen to your posterior lung sounds now. Go ahead and take a deep breath in and out for me.
I'm gonna go ahead and inspect your abdomen. You can lay back down for me. Okay, I'm just looking for any distension, bulging masses, scarring, bruising, tubes or drains. Everything looks good. I'm gonna go ahead and auscultate now for bowel sounds. Putting at the right lower quadrant. Okay, bowel sounds are normal. I'm gonna go ahead and percuss now for any dull or tympanic sounds. I'm gonna go ahead and palpate for tenderness or any masses. Any pain when I do this?
No.
Okay, do you have any nausea, vomiting, or difficulty eating?
No.
And what was your last bowel movement?
Today.
And was it normal for you?
Yep.
Okay, great. So I'm just gonna inspect the perineal area. Everything looks clean. There's no Foley present, and there's no skin breakdown in the perineal area. Do you have any difficulty when urinating?
No.
Any pain, hesitation, blood in the urine? Okay, so I'm gonna go ahead and inspect your lower extremities now. So go ahead and lift your knee up for me. Okay, there's no stiffness or pain when I do this. I'm just gonna go ahead and inspect the legs now for overall hair distribution, skin breakdown. Everything looks good. Go ahead and press your feet against my hands. Okay, overall condition of the feet look good. Nails look good. Cap refill is normal, less than 2. Just palpating for edema. Okay, calves are not hot to touch. There's no redness or swelling. Just gonna go ahead and palpate for your femoral pulses now. Go ahead and lift your knees up again. Your popliteal. I'm done. Your dorsalis pedis. And your posterior tibia. And do you have any difficulty walking or use any assistive devices? Okay, you can go ahead and get up for me now. Stand close to the couch or something. Go ahead and put your arms to the side. Close your eyes. Just checking for swaying. You can put your arms down, open your eyes, walk towards me. Turn around and walk back. Okay, you can go ahead and sit back down. Did you have any dizziness while doing this?
No.
And did you have any falls recently?
No.
Okay, and do you have any thoughts of hurting yourself or others?
No.
And do you feel safe here and at home?
Yes.
Okay, perfect. So I'm gonna go ahead and raise the bed back down, lower the bed back down, raise the side rails. I'm gonna give you the call light and use this if you need anything. And I'm gonna go ahead and wash my hands and leave the room.